Yeah, Liana, you wanna?
So Quan, I think if you don't mind, I'll just do some general introductions.
Yes.
And since folks are joining us here on the webinar version of the Zoom meeting. So good morning, everyone. This is a culmination of a lot of work by our fellowship programs, and we're really pleased and proud to have such great representation from the state of California, Stanford and UCLA, going head to head to represent California at our national meeting. I'm confident that whoever comes out on top here will show us well in the national competition. Around the Hollywood squares here, in addition to Stanford and UCLA, are Megan and Penny. They are our fellow FIT, what we call catalyst here. And they've done a tremendous job coordinating this and other events. And then we have our esteemed Arizona colleague, Dr. Quan Lee, who is a governor who I have been mentored by in many ways as I'm coming in and he's going out. But he is Alex Trebek today, or Alec Trebek. He is very good. I am the judge, and the quality of judging is equivalent to the amount of honoraria I'm getting today to supervise this competition. So we're going to do our best, but in the spirit of camaraderie and healthy competition, we're just excited to host this event today. We are going to try to keep it to 30 minutes is the plan. So at 15 minutes, we'll transition to Double Jeopardy. And then at 27 minutes into the competition, we will transition to Final Jeopardy. With that, I'd like to turn it over to Quan to take the reins for this Jeopardy competition.
Thank you, Anthony. Just to go over some general rules before we get started, you'll be familiar with this since we were just here 2 weeks ago. Once again, the answers are from our national committees, so we're not going to debate the answers. I think they've been vetted. I went through all of them and made sure that everything was as tight as possible. Any ambiguous answers from you that are close to the answer, Anthony, as he mentioned, will arbitrate on. The buzzer, once again, only comes live after I have completely read the question, and that's in the spirit of learning and not just, we don't want this to degenerate to just a pure free-for-all buzzer competition. For the daily double, the team must answer the question and must wager, and they continue to keep control of the board after the daily double, and the other team cannot answer. We will not tolerate any questions. We won't give any points to answers not in the form of a question. I think since everyone is familiar with Jeopardy at this point. And then once again, the 30-minute playtime thing. And finally, at the end, for the Final Jeopardy, we will ask you to write your wager down first on a piece of paper that we can hopefully see on the camera, and then write your answer on the same piece of paper and then show us instead of trying to email it, because that can create all sorts of issues. So please have a piece of paper and a pen and be prepared to hopefully tilt your camera just so that we can see that the paper hasn't gone to strange places. With that, let's get started. So I'm gonna go to, sorry, I haven't also figured out how to make the Jeopardy music come on. I can hear it, but nobody else can hear it. So hopefully that works out. Give me a second. I'm going to share my screen. Okay, does that look good? Is everyone good?
Yeah, perfect.
Okay, so let's get started. I think UCLA had the coin flip in the beginning. So UCLA.
We'll do its electrical for 100.
Electrical for 100. So this is an autosomal dominant inheritance pattern, and the ECG finding below is characteristic of this condition.
UCLA.
What is arrhythmogenic cardiomyopathy?
Yeah, that's correct. That's an epsilon wave there at the end of the thingy. So UCLA, I'm going to go blue and Stanford red. Is that okay? Okay, so we're going. UCLA?
We'll do it's electrical for 200.
If a patient with the ECG below has palpitations associated with AV re-entry, the ablation catheter should be placed in this location in the heart.
UCLA.
What is the mitral annulus?
Yes, that's correct. So that's a left anterior pathway. And it's, you tell that the left side by having a predominantly positive, R in V1, and then you look at the 2-3 AVF to try and decide whether it's anterior, etc. So that's correct. What is the mitral annulus? UCLA?
We'll do it's electrical for 300.
Okay, the electrolyte that may be directly related to the mechanism of this unique arrhythmia.
Stanford.
What is potassium?
That is incorrect. UCLA, you have an opportunity. Okay, we're passing. The answer to the question is calcium. Yeah, it's an example. That EKG is obviously a bidirectional VT, which is seen in ditch toxicity as well as cholinergic polymorphic ventricular tachycardia, which is associated with calcium channel mutations, and is one of the causes of sudden cardiac death and syncope presentation. It's rare, but it's a gain of function of calcium. It's UCLA.
We'll do pericardium for 100, please.
Respiratory variation of the mitral inflow velocity measured by Doppler that varies by more than this percentage is supportive of a diagnosis of cardiac tamponade.
Stanford.
What is 25% or more?
Yeah, that's correct. What is 25%? Stanford, you have the board.
Let's do pericardium for 200.
The pattern of RV pressure seen in the tracing below suggests this diagnosis.
Stanford.
What is TR?
No.
UCLA.
What is constrictive pericarditis?
Yeah, that's correct.
For pericardial constriction, I mean, yeah.
Yeah, pericardial constriction. What we're seeing here is a square root sign on that RV tracing. So, yeah, that's correct. UCLA?
We'll do oddball for 100.
Okay, a 35-year-old man presents to your clinic for follow-up. He was diagnosed with hypertrophic cardiomyopathy 1 year ago. He is asymptomatic. Based on the ACC AHA 2020 HCM guidelines, surveillance monitoring with transthoracic echo is recommended in this patient every blank years. And this is a class 1 recommendation.
UCLA.
What is every 1 to 2 years?
Yes, that's correct. What is every 1 to 2 years? UCLA?
Can we oddball for 200?
Name the phase of the cardiac cycle between A to B.
Stanford.
What is isovolemic contraction?
That's correct. Yeah, clearly there's no change in volume, but the pressure is rising. Stanford?
Oddball for 300, please.
Mutations to the gene producing this protein has been strongly implicated in Marfan syndrome?
Stanford,
What is fibrillin gene?
Yes. Anthony, are you good with that?
FBN.
Well, we'll say yes. Anthony has not weighed in, but I'll take that. Yeah, it's fibrillin 1. It's more than one fibrillin. Close enough. Stanford?
Let's go oddball 400.
A 45-year-old man with hypertrophic cardiomyopathy presents to your clinic for follow-up. He was recently diagnosed with paroxysmal atrial fibrillation during his annual physical exam. Based on the ACC 2020 HCM guidelines, the first line option anticoagulant is blank, and the second line option anticoagulation is blank. You must provide the answer in the correct sequence. No answer? I'm gonna put the timer on when it runs out. Okay, so the answer is what is DOAC as first line and vitamin K antagonist, just like with regular atrial fibrillation. All right, yeah. I think Stanford still has it.
Race against time 100, please.
The length of time for which ACE inhibitors must be discontinued prior to initiating sacubitril valsartan or Entresto.
UCLA came first.
UCLA?
What is 36 hours?
What is 36 hours? That is correct. UCLA?
Look at a race against time 200.
Based on the defined flare study, a value at or below this number, is considered significant for IFR.
UCLA.
What is 0.89?
Yeah, that's correct. Yeah, I think everybody is pretty familiar with this trial, so I'm not going to go through it. UCLA?
Pericardium for 300.
This structure forms the lower boundary of the transverse pericardial sinus. Timer is on. Okay, the answer is the left atrium. It's just underneath and forms a lower border. The transverse pericardial sinus is useful for the surgeons because that's where they can clamp the great arteries as they're coming out. Okay, UCLA, you still have the board?
Einthoven's World 100.
Hey, this is the diagnosis represented by this ECG. Timer's on.
Stanford.
Acute pericarditis.
Sorry, Stanford, that has to be in the form of a question.
What is, oh man.
Yeah, all right. UCLA.
What is acute pericarditis?
Yes, sorry, Stanford. It's brutal. UCLA, you have the board.
Einthoven's for 200.
This is a diagnosis represented by this ECG.
UCLA.
What is posterior STEMI? Inferior-posterior.
Yeah, that's correct. Pretty straightforward. UCLA?
We'll do Einthoven 300.
Okay, this is a diagnosis represented by this ECG. Timer's on. Okay, that's a right ventricular hypertrophy, right? V1 is big with, and it's narrower than 120 milliseconds, so it's not due to a right bundle branch block. You know, you don't, in this case, the S wave is not that huge, but you know, there's enough there to support that. Okay, I think UCLA still has the board, right? And this is out of the game right now.
We'll do pericardium 400.
Pericardium for 400. This carcinogen is the cause of a rare malignancy that is the most common primary pericardial tumor. Okay, the answer is asbestos. The mesothelioma is the most common primary pericardial tumor. So it's asbestos. Okay, wait, let me get this off the board for a second here. Sorry. I forgot to press that. All right, still UCLA.
A race against time 300.
IV cangular is being infused in a patient with STEMI to ensure absorption. Only this oral FDA-approved antiplatelet can be given while cangular is being infused.
UCLA.
What is ticagrelor?
Yes, that's correct. What is ticagrelor? UCLA.
They also know.
Race against time 400.
This patient does not have constriction. This condition can result in rapid Y descent in the right atrium. I'm going to put the timer on. Okay, yeah, the answer here is tricuspid regurgitation. I think Maggie, you had that mixed up earlier. You know, there's a prominent V wave, and then you have this very quick Y descent, and severe TR is one of the causes. There are other causes like severe RV failure, and ASD is listed, but I think with the V wave, it's more likely going to be TR. UCLA, I think, still has the board.
Eindhoven for 400.
This is the diagnosis represented by this ECG. Yeah.
UCLA.
What is lead reversal?
Yes, that's correct. Limb lead reversal specifically. You know, V1 to V6 look pretty normal. AVR is positive, AVL is negative, but you know, AVF is unaffected, and then 2 and 3 are reversed.
I don't think they actually got the points for that one.
Oh, sorry. Yep. I gotta click that. Thank you, Pani, for keeping us honest. All right. I suppose UCLA is going for electrical for 400. The tracing below is characteristic of a channelopathy that was originally described as inherited in what manner? Okay, that's long QT, right? A very long QT on the EKG, greater than half. So it's autosomal dominant. Okay, we're making good time, so we're moving over to double. All right, UCLA.
We'll do congenital for 200.
Oh, great.
Okay, the diagnosis depicted by this image is
UCLA.
What is core triatriatum sinistra?
yeah, that's correct. Yeah, the sinister referring to the left atrium, left side. All right, UCLA.
We'll do congenital for 400.
ACC guidelines recommends class 1 surgical repair for adults with the condition shown in the image if any of these criteria are present. Name one. Put the timer on.
UCLA.
What is right ventricular failure?
Yeah, that's correct. So this is Epstein's anomaly. In the presence of, in addition to this severe tricuspid regurgitation, there are quite a few, criteria that would predispose you towards recommending surgery, and that's RV failure. Hold on, I gotta click yes.
Aggressive symptoms.
Yep.
Volume overload.
Yep. Exactly. All right.
We'll do congenital for 600.
600.
Congenital 600.
Okay, the cause of the echocardiogram finding is turning the timer on. Okay, that's
UCLA.
go ahead, UCLA.
Yeah, what is persistent left SVC?
Yeah, that's correct. Yeah, so you're seeing a contrast come through a left SVC, coronary sinus into the right atrium and filling in that direction. Yeah, persistent left SVC. Okay, UCLA.
We'll do congenital for 800.
Congenital for 800. Okay, the diagnosis indicated by the echocardiogram below is putting the timer on. Okay, the answer is quadricuspid aortic valve, right? There's 4 leaflets, not 3.
Oh.
Yep. And for some reason, the daily doubles are not working today. Some of these were supposed to be daily doubles when I ran the algorithm before, so looks like we might be without daily doubles. UCLA?
We'll do decongestion for 200.
Sacubitril valsartan has demonstrated mortality benefit in heart failure with reduced ejection fraction. Aside from hypersensitivity to its components, these are the 2 contraindications to its use. So we need 2 based on the 2017 ACC focus update of the heart failure guidelines. Timer's on. Okay, so the answer is a history of angioedema or use of ACE inhibitors within 36 hours.
Are you afraid? Let's just go for it.
Juan, I have identified and have written down what the daily double will be in Double Jeopardy here, okay?
Okay, that's fine. That's good. Okay, so Anthony is going to...
I'll notify you when that tile is selected.
Perfect. All right. UCLA?
We'll do decongestion for 400, please.
Okay. Vericiguat is a class of this type of drug, which has been shown in a cohort of high-risk patients with heart failure with reduced ejection fraction to reduce a composite endpoint of hospitalization for heart failure and cardiovascular death. That was the Victoria trial.
UCLA.
What is a soluble guanylate cyclase agonist?
Yeah, that's correct.
I don't know what's happening.
All right, UCLA?
We'll do decongestion for 600.
Decongestion for 600. In heart transplantation, this can occur in the setting of preformed cytotoxic antibodies to the donor heart. Timer's on.
Stanford.
What is hyperacute rejection?
Yes, that's correct. And obviously, this may be seen in patients that are highly sensitized or cases of ABO mismatch. All right, Stanford.
Yeah, decongestion 800.
Decongestion for 800. Per the ACC AHA 2020 guidelines, the surveillance screening interval of asymptomatic adult first-degree relatives of patients with clinically diagnosed hypertrophic cardiomyopathy is?
Stanford.
What is 3 to 5 years?
That's correct. Yeah, every 3 to 5 years. Stanford?
Yeah, that's on the board. Here you go.
Let's do critical thinking, 800.
Critical thinking 800. According to the SKY classification of cardiogenic shock, a patient with a pH of less than or equal to 7.2 and lactate greater or equal to 8 have biochemical markers consistent with this stage of shock.
UCLA.
What is stage E for extremis?
Yes, that's correct. Yeah, it used to be 5 in the older SKY categorization, but it's become 8 for lactate in the most recent update published in JSky. Oh, I gotta say yes or no. Sorry. I gotta give you the points. All right.
Oh, you
All right.
already gave him a point.
Oh, I did?
Yeah.
Okay. I'm gonna adjust scores. Give me a second.
So it'll be 4,300.
Okay. Thank you. Okay. UCLA?
We'll do critical thinking 200.
Critical thinking 200. Toxicity from this common cardiac ICU drug can lead to a cherry red appearance, confusion, seizures, and skin rashes.
UCLA.
What is nitroprusside?
Yes, that's correct. And that's cyanide or thiocyanide toxicity. Did their score go up?
Yeah, it should be
Not yet.
4,500, but it's not
Yeah.
letting you do it. It's
Yeah,
not
that's-
letting you give it anymore. That's weird.
Yeah, that's weird. I'm going to adjust scores here again.
Oh, I hope you don't have to do that for everyone because we adjusted it.
Yeah, I know. It's kind of awkward. All right. UCLA?
Not your normal tissue for 200.
Okay. You have to name both the type and position of the valve seen in this echo picture.
UCLA.
ahead.
What is a ball and cage mechanical prosthesis in the aortic position?
Yes, that's correct. Yeah, that worked. Okay, good. UCLA?
We'll do hanging around the heart for 200.
Okay, this is an MRI of the heart in 2 separate physiological states. The diagnosis portrayed by the image is timer is on. So in this case, it's a constrictive pericarditis or constrictive, pericarditis constriction state. And there's obviously pleural effusion. This is inspiration, the lung is bigger, the RV is larger, expense of the LV, and then with expiration, the opposite is true. Okay. UCLA?
Can we do critical thinking for 400?
Yes. Okay, I'm going to read this slowly. This is the RV stroke work index, and the unit is millimeter mercury, milliliters per meter squared for the following hemodynamics. The right atrial pressure is 15 millimeters mercury. The RV mean is 21 millimeters mercury. The PA mean is 27 millimeters mercury. The wedge is 23 millimeters mercury. Cardiac output is 3.4 liters per minute. Cardiac index 1.8 liters per minute per meter squared. Heart rate is 60 BPM and blood pressure mean is 71 millimeters mercury. I'm going to put on a timer. I think I went slow enough. Yeah, I think it's wise that no one took this on. But essentially, it's you have to take the stroke volume index, which means you are looking at 1,800 milliliters divided by 60, and that gives you the index stroke volume per beat. And then you have to take the mean PA minus the mean RA pressure, which gives you the RV stroke work index at 360 millimeters mercury. I had to look that one up. All right, UCLA?
Not your normal tissue for 400.
After the first 3 months, INR targets for the on-X valves and aortic position can be reduced to this INR range when there are no other thromboembolic risk factors.
UCLA.
What is 1.5 to 2.0?
Yeah, that's correct. And you make sure to also don't forget the aspirin. Yeah, lower INR plus aspirin.
It's a mechanical.
UCLA.
Really good at predicting problems.
Hanging around the heart for 400.
Okay. According to the ESC guidelines, hospitalization for acute pericarditis is recommended for high-risk patients with any of these risk factors, and there are quite a few. We only need 2.
Stanford.
What are symptoms or troponin elevation?
Anthony, how do you feel about that?
Yeah, I mean, symptoms and troponin elevation are biomarkers and chest pain.
Okay.
So I'm okay with that.
Okay. Yeah, it's not quite what they say, but we'll accept that. Troponin elevation being a surrogate for the myopericarditis, right? And then symptoms, I suppose, lack of response.
Yeah, I'm okay with it.
All right.
I didn't get the points for that.
Yeah, well, that's weird, huh? Okay.
Penny, did UCLA get the points on the last one? It went up to 5,100 from 45.
Yeah, that worked the last one.
Yeah, so what was that again? That was
It was 400.
400 for 1,400.
Yeah, hanging around the heart.
Hanging around the heart, right? Okay, give me a second. Let me adjust scores here.
I'm adding an extra minute and a half to the.
Yeah, to compensate for the macros not quite working right.
Yeah.
Okay, Stanford.
Critical thinking 600.
Critical thinking 600. Current ACLS guidelines provide information on assessing quality of CPR, in addition to visual assessment of the depth and speed of compression. This is one of 2 objective thresholds that indicate inadequate CPR quality. Just need 1.
UCLA.
What is a low end tidal CO2?
Yes, that is correct. Yep. Or a low diastolic pressure as well. All right, UCLA.
Hanging around the heart 600.
Kwan, that's the daily double.
Okay, this is daily double. All right. So you may wager up to $5,700 if you choose. Although, you know, Anthony, it's a little awkward because normally with the wager for daily double, you don't see the whole question before that. You just see the category, right?
Yeah.
Should we skip it then? Because that's not quite fair.
Let's skip it. Let's just do the value of the question.
Okay. Yeah. So this condition is evidenced by the presence of a pericardial effusion with tamponade physiology and failure of RA pressures to fall greater than 50% or below 10 millimeters mercury after pericardiocentesis. You have to answer the question.
Stanford.
What is effusive constrictive?
Oh, sorry.
No, it's UCL. This is a daily double. It's going to
No,
behave like it did.
I was thinking we were going to do away with the daily double.
Oh, I see. Okay, then Stanford, go ahead.
Yeah.
Okay, so what is effusive constrictive pericarditis?
Yes, that's correct. All right, I'm going to go fast since this is exciting. Stanford.
Not your normal tissue 600 or 800.
Right.
Sorry, 800.
Oh,
It's
too
fine.
late.
If we it's fine. Let's do that. Let's do that.
Clots larger than this size by area favor the decision to proceed with surgery over fibrinolysis for acute mechanical valve thrombosis.
One centimeter. 1 centimeter. 1 centimeter.
What?
Sorry, who was that?
Who's the person that just joined here?
I don't know, but the timer is running out. All right, the answer is greater than 0.8 centimeters squared. Stanford.
One more question, Kwan.
Yeah, Stanford.
Hanging around the heart 800.
Okay, the diagnosis of recurrent pericarditis includes these time-based criteria. I'm gonna put the timer on. This is a tough question. It's kind of a little strange. All right, sorry. No go. What is recurrent disease after a documented symptom-free interval of 4 to 6 weeks or longer? And this is from European guidelines. Okay, so we are now moving to the final Jeopardy.
One more question.
All right, so hold on. Final Jeopardy. Hey, the category is seeing is believing. So just as a reminder, write your wager amount down to start with, and the maximum is obviously what's currently in your bank. All right, are you both ready?
Yeah.
Okay.
Yes.
So you need to press this button.
We're gonna say when we wager. Yeah.
Okay, the diagnosis and associated imaging findings are, so both the diagnosis and the imaging finding. Yeah. So write your answers down on the same piece of paper. Okay, are we ready?
Just a quick second, we're finishing writing the answer down.
Okay,
DOT grade.
yeah. UCLA, you good?
Wait, hold on 1 second.
Stanford? Okay, Stanford's good. UCLA, you gotta wrap up. Okay, we're gonna look at the
Finished, yeah.
answers. Great.
Yep.
So this is a mid-cavity variant of hypertrophic cardiomyopathy with an associated apical aneurysm. All right, let's see what you have, UCLA. Ken, oh, that's so small. Hold on.
Sorry,
Apical-
we can read it out. It says, what is apical HCM with apical LV aneurysm?
Did you say apical HCM?
Yeah,
Correct.
Okay, that's
that's not correct.
yeah, that's not correct, right?
Their
That is
wager
not-
was $0.
Okay. Stanford, what did you have?
You were wrong.
I can't, you're moving it. We're old. We can't read that fast.
Yeah.
Definitive
progressive.
septal hypertrophy. Slide down. What was the top part?
Oh,
HCM,
but we were
TTE
wrong.
with definity septal hypertrophy. You were describing it very well, just not complete. All right. What was your wager?
Everything.
Everything.
Everything. Las Vegas. You get to the bank. Well, okay, great. Wow. Anthony, you want to announce the winners? And
Yeah. Well,
Wrap it
first,
up.
you guys knew a heck of a lot of questions. Impressive. You guys.
yeah, it's really impressive.
A testament to your efforts and your programs. You make us proud. The winner this year, representing the state of California, will be UCLA. We really appreciate, again, your guys' time on a Saturday with families and so forth to spend your time with the California ACC. As one of the governors, the Fitz are the shining stars of our chapter, and we're so thankful for each and every one of you. And with that, Quan, I don't know if there's anything else you need to say.
No, I just want to say thank you for having me, and really impressed with the quality of all the California teams. Stanford, you guys rock, and UCLA, you guys are amazing. So hopefully we'll see you at nationals in a few months.
All right, guys, have a blessed weekend. Keep up the good work.
Yeah, and thanks also to Megan and Pani. Pani kept us honest for sure. And,
Fanny, you earned your keep today.
I know, I worked hard today.
yeah, and
right, thanks.
also-
Congratulations, guys. You guys are both wonderful.
Right now, obviously, a final shout out to Liana for being just awesome, and
Shout out to Leanna for being Leanna.
yeah, engaged and involved. And
Thanks, guys. Great competition.
Take care.
Congrats, everybody.
bye.
Thank you, everyone.
Thank you.